Hello, I'm Dr. Robert LaBelle. Welcome to the neck exercises at CCSR. Today we'll be going through 3 neck stretches, a postural exercise, and a strengthening exercise. This is a complete rehabilitation program to help the neck. We'll initially go through the stretches. The first stretch that we're going to go over is an upper trapezius stretch. That's for right here, and it'll be felt through there. So Ariana, I'll have you tip your left ear to your left shoulder. During this exercise, you want to make sure that your chin's not out and that it's tucked in somewhat. I'll have you grab the side of your head with your left hand, Ariana, and just gently push over to the left as well as depress the shoulder down. You'll feel a decent stretch through here. All the stretches that we're going to show you today, I want you to hold for 30 to 60 seconds and do them about 2 to 4 times a day or as needed. That's the first stretch, which stretches the side. The second stretch isn't much different. You're going to tip over to the left again, and then you're going to rotate your nose down at a 45 degrees, and you'll grab the back of your head, and you're going to pull forward down towards your hip. This stretch will be felt more in the back here, and this is stretching a muscle we call the levator. Once again, you'll do it on both sides for 30 to 60 seconds, 2 to 4 times a day. The third stretch that we do is for the front of the neck, and it's for a muscle group we call the scalenes. It's a little bit different. Ariana's going to position her thumb right on her collarbone, and then she's going to pull the skin down on the top of the chest. And then as she does that, she's going to gently look up until she feels a little bit of a pull to the front of the neck. This is a good exercise for people who have a certain amount of numbness or tingling in the hands and also post-whiplash. You can come out of that. Any of the stretching that's done shouldn't be done into pain. We should just be stretching till we feel a mild amount of discomfort. And as time goes on, the tissues will become more and more flexible and your pain should drop out. The fourth exercise in the neck rehabilitation program is a postural exercise we call a dorsal glide. What Ariana is going to do is she's going to tuck her chin backwards. This can be done at any time during the day. I typically recommend it when patients are driving or if they're seated at their desk. This exercise is done holding this position for about 20 to 30 seconds, done 10 or 20 times during the day. The point of this exercise is to reset the joints, taking pressure out of the back of the joints and counteracting the upper cross syndrome, which is that forward flex posture with the head up. You're basically doing the reverse. You're coming up, chest is high, and then you're tucking that chin back. That's good. The fifth exercise that we're going to go through is actually a strengthening procedure. So I'll have you lay down, Ariana. This is known as a chin retraction exercise. And what we're doing here is we're trying to strengthen some deep neck flexor muscles. When those deep neck flexor muscles are strong, they sit behind the trachea and the esophagus, or the food and the windpipe. When those are strong, they'll start to support the head upright, thus taking pressure out of the painful tissues. So how we do this one is you tuck your chin in just a bit, and then you elevate your head a centimeter off the back of the table. Things to watch for here are the shoulders elevating and the chin retracting. If there's any shaking, which we can see a little bit of, it denotes a certain amount of weakness. And so you want to start off with this exercise a bit slowly, doing about 10 of them a night, holding for about 5 to 10 seconds. As the weeks go on, you'll end up progressing those 10 repetitions, holding them for 20 seconds, 30 seconds, and eventually holding it up for a minute.